Alrighty, so if you have made it to this video, that means you have done one of two things. You have successfully prepared for your written state board, and you are now ready to prepare for your practical. Or you have graduated and you are coming back to reference the practical information so that you can go on and take the state board and get it done. So this is the last step that you need to take before becoming a licensed professional. In this case, we're going over the esthetician version, but all other programs under cosmetology will have to take a written and a practical. Now that you're prepped or have taken the written, you're able to move on to the practical. So before we go into each individual section, the first thing that I want to do is go over the practical exam in general. So the practical exam as an esthetician is 1 hour and 55 minutes in length. It could be shorter depending on if you are taking it on your own and move through the sections quicker, or it could be as long as 1 hour and 55 minutes. There is never a scenario that it will be longer than that unless something happens in the testing center, because each section, as you'll learn as we go through it, is timed to only allow for certain a certain amount of time frame. So the following information will be used by the examiners or raters to grade your performance during the practical exam. So when you come into this exam, the proctor or the rater is actually going to give you pretty clear instructions. They're not going to be able to answer any questions regarding the steps that you have to take or the order that you need to take them or the exam as a whole. Really, what they're going to do is tell you the rules, the call out each section, tell you when to start, check your progress throughout, tell you when to finish, and that's it. When you're done with the exam, everyone will have their closed kit and be ready to go. And on your way out the door, they will give you your results. In the case that you are able to take this exam on Zoom, they will email you those results. You won't know that you passed right away, but if you follow this step by step, you should have absolutely no problems. So for each section, we're going to do the items that you need in that kit bag separately. But for the sake of this introduction, I want to go ahead and list the supplies and equipment that they have noted that need to be labeled versus unlabeled versus what's supplied by the vendor. That way, when we go into each individual section, you'll already know if it needs to be labeled, unlabeled, if it needs to manufacture label, so on and so forth. After we do that, we'll go into the general information that they're going to read to you. And then each video following this one will be the actual section. We'll talk about the supplies. We'll go through the step by step. And then from there, there will be a video component where we're actually doing each step by step for each video. So supplies and equipment. Candidates are responsible for bringing all necessary supplies and equipment needed to perform all services. Review the practical examination content outline. That's what we're looking at now, our content information bulletin, AKA our Bible for this exam. We just finished the written part. It's right after it in the same candidate information bulletin. To ensure you bring all supplies you need to perform these services, they have created this outline. They have also included what they're rating you on for each section and what order you need to do them for each section. So I've said this before, I will say it again. There is no necessarily right or wrong way to do it, as long as you do it safely, sanitary, and in the order that they prescribe in your CIB, then you will pass this exam. I'm going to show you one way, but there are 100 different ways to take this exam. Please feel free to perform it in the way that's best for you. Of course, you are not allowed to look at your neighbors when taking the exam or any reference material. So I wouldn't even stress about what anyone else is doing for the exam. Just do what feels comfortable and right for you. So let's go through our list and then we will move on to break down the sections before we move into actually preparing for them. So the items that are not to be labeled that you need to bring is cotton pads, sponges, or facial tissue. Notice that these are all disposable items for product removal, but they don't tell you to have it labeled and they don't tell you which of them to use. You can bring all of them. You can bring one type of them. You can bring one of each of them. Whatever you like to work with best is up to you. You may bring that item. Next is a bowl for water. As you see here, it says optional. And what they're telling you is there are sections that will require product removal. So therefore you will need water. You can bring a bowl of water and a bottle of water. You can bring a bowl of water and use their sink to get water. You can bring damp sponges. You can bring damp 4x4s. You can bring a damp towel. As long as it's not labeled, you're fine. Disposable applicators for any application or removal of products from your containers. Your drapes to drape your mannequin's décolleté and your mannequin's hairline. You also need eyelash strips, fabric strips for waxing, gloves or finger cots, the head draping, which is just continuation of the draping, your mannequin head, which needs to be prepared with a strip eyelash on at least one eye. You can prepare it with a strip eyelash on both, but you're only going to perform the services on one eye. The mannequin stand or tripod, you can also lay your mannequin flat on the table. I would recommend laying your mannequin flat on the table and not to bring a mannequin stand or tripod because they can fall over. A mask brush, paper towels, small scissors, towels, and tweezers. All of those items throughout your separate kits will need to remain unlabeled. What I recommend doing is putting them in their own Ziploc bag and putting pre-sanitized implements on the outside of the bag, but don't label them cotton round, 4x4, anything like that. The items that must be labeled in English only. Your kit labeled pre-sanitized, clean, or disinfectant. So you will be packing a kit for the exam with each section inside of it. That main kit can be a bag, it can be a Tupperware, it could be anything that closes 100%. At least 30 by 30 is ideal so that you have enough space and it won't, be forced to stay open. And it needs to be labeled pre-sanitized on all sides, cleaned or disinfected on all sides. You can use any type of label. So you can get sticky paper, handwrite the pre-sanitized, cut it out and place it on each side of the kit, or you can print labels. It's 100% up to you. I'm going to link a document that has labels, all the labels you'll need typed out. So if you get label paper, print them on label paper, you can cut them out and you're good to go. Antiseptic or soothing lotion needs to be labeled, astringent, freshener, or toner. Again, one of three of these options or all three. Blood exposure kit, first aid kit, cleansing products, so your cleansers need to be labeled. Your EPA approved disinfectant or simulated product needs to be labeled. Eye makeup remover needs to be labeled. Hand sanitizer needs to be labeled. Lash adhesive, mask or pack product needs to be labeled. Moisturizer needs to be labeled. Massage products, simulated products for soft wax, i.e. Vaseline or honey, need to be labeled. And a trash bag needs to be labeled trash on all sides. So what I recommend that you do is print out the list of labels and just check them off if you want to make your own labels or if you want to handwrite them. That way you know each bag and item is properly labeled. Also note that manufacturer labels are fine. So when you buy hand sanitizer, it says hand sanitizer. That's absolutely appropriate. Same for your massage cream, your moisturizer, your eye makeup remover, your antiseptic or astringent. All of those things can come in bottles that are already labeled, so you can keep them in those bottles. The way we do the exam is we individually portion out products in a travel size bottle and then label the bottle with whatever it is. To answer the question that you're all going to ask is, do I have to have real product in the container? Yes and no. So for some items, they're going to be real product. For example, your what's the word? Your blood exposure kit, your first aid kit needs to be labeled. Like Band-Aid needs to have a Band-Aid label on it, so on and so forth. But your eye makeup remover, because you're not doing this on an actual person, can be water. so can your EPA approved disinfectant. For the EPA approved disinfectant, I would actually use EPA. That way, because they know that it's blue. So I would use actual EPA and, dilute it and put it in there. But toner, freshener, cleansing product, your massage cream, your moisturizer, all of those can be fake products. If you want to, if you have a lotion that's like purple or blue, you can use that lotion for your mask, your massage, and your moisturizer, because you're going to put it on and take it right back off. So from there, the items supplied by the vendor are going to be brooms and dustpans for you to clean up your area if you make a mess. Covered trash cans, you will not be using their trash cans for anything. A mounted wall clock, just to keep time. You don't need to keep time. The proctor will do so. So I wouldn't worry too much about that. And then workstations, manicure table with chairs. So apparently they have removed all of the esthetician beds, and now it is just a manicure table and a manicure chair. So easier for you. So you would just use that for your station. And obviously you would use the chair to sit in for yourself. All of those things are supplied by the vendor, so you don't have to worry about bringing them. And then let's look at the content outline, and then we will go break down into our individual videos. So again, the exam is 1 hour and 55 minutes in length. You can get a total of 86 points, and you need 61 points to pass. The points are going to come from these individual sections. I'm air quoting sections here because I want you to think of the exam as 8 parts, technically 9 parts. So the exam is 9 parts, and you will have 8 bags. And each of those parts, pre-exam setup and disinfection, eyelash strip application, cleansing service, mask, pack and moisturizing service, steaming service, what's another one? Soft wax service. All of those are sections in the exam. And because of that, all of those sections will have their own kit bag within your main kit. So 8 bags, 9 section, and those 9 sections leave you eligible to get 86 points or 100%. But to pass, you only need to get 61 of those points to pass with a 70%. So let's look at the sections real quick. Let's do a quick review of the sections, and then we will do the general information that the proctor wants you to know and what they'll read to you before you begin, and then we'll go into each individual section. So the 9 sections are pre-exam setup and disinfection. You get 10 minutes for that section. They warn you when you have 5 minutes remaining, and these are the safety criteria that you earn points for. Then you have eyelash strip application, 14 minutes. They'll warn you at 7 minutes. And these are the safety criteria and the procedure criteria that you earn points for. Cleansing service, you have 14 minutes, and you're informed when you have 7 minutes. Steaming service, you have 7 minutes, and you're informed when you have 4. Massage service, you have 17 minutes, and you're informed when you have 9. Mask and moisturizing service, you have 17 minutes, and you'll be informed when you have 9. Waxing service using soft wax, 14 minutes. You'll be informed when you have 7. And the blood exposure incident service, you have 12 minutes, and you're informed when you have 6. The last of the 9 sections is end of exam disinfection. This is the only section that will not have its own individual bag within your main kit, because everything that you need to do this section will already be out and on your station. So think of each one of these sections as a service. If you were going to do a client service for a massage, and then after that massage, you were going to do a massage mask service for a different client, you would set up your station, pull out all your supplies that you need from the work cabinet, and then you would set up your little cabinet, and then you would go in, do your sanitation, do the service, do your post sanitation, and then set up for the next client. This exam is essentially you doing 9 miniature services. They just tell you what the service is. So each bag that we bring is going to have everything we need for said service. If we don't have it in the bag, then we have already pulled it out on our station and it's ready to go. So the last thing I want to do in this video is talk about the proctor and what information they're going to give you. So before the exam starts, you're going to go into a room, or if you're taking it on Zoom, as of May 1st, 2023, you're still eligible to do that. But we don't know how long that's going to last. So as of right now, if you're taking it on Zoom, your proctor will, join the Zoom, read the same instructions to you that they would read if you were in the facility, and then the exam will begin. So here are these instructions, and it's read out loud to you when you go into that exam center. So let's start from the top here. The following information will be used by examiners to grade your performance during the examination. All procedure criteria must be met and performed in order listed for candidates to receive points for the task. Do not begin any procedure until the instructions for each section of the examination are read and you have been instructed to begin. It is not necessary to perform additional or altered steps, tasks not listed below. Items not listed below are not rated during the examination. Candidates must step back and raise their hand at the end of each section, indicating completion. Candidate begin general instructions. So candidate beginning general instructions. This is read after all of the candidates have been checked in and the rater and candidates are ready to begin. So you have been checked in at the front. You're going to arrive 30 minutes to an hour early. You're going to walk to the door 30 minutes early. You're going to check in with your ID and your exam receipt. They're going to tell you where to go. You're going to sit quietly and wait. You're not going to have any phones, any devices, no music, no headphones, no notes. No purse. You're going to go in. You're going to wait for instructions. Once you have been guided into the room where you are going to take your exam, and the proctor has put everyone at a station and they're ready to begin, they will read the following instructions. Welcome to PSI. Congratulations on passing your written examination. The proctor for this session will read the instructions, keep time for each section, and can only answer general questions that do not direct or instruct you in any way concerning this examination. The raters are responsible for observing and rating your skills performance and are not allowed to converse with candidates except to provide a general salutation. Once the examination begins, you may place all of your supplies in your assigned workstation. You may not observe the work of other candidates. Please do not speak to or assist any other candidates during the examination. While you may use the restroom during the examination, please keep in mind that the time will continue to elapse and any instructions you miss will not be repeated. Only one candidate at a time may leave, so please return as quickly as possible. Does anyone have any questions about the instructions I have read to you? They'll look around, they'll see if there's any questions. If there are questions that do not directly instruct you, or if you need them to say something again, they'll do so, and then the exam will begin. I'll stop from here and we'll go to the next section, which is going to be the pre-exam setup and disinfection. We'll talk about what's in that kit, and then we will go through the step-by-step, well, the expectation, and then the step-by-step for that section.